If you have been dealing with persistent neck pain and that's been ongoing for a while, I wanna in this video give you some tips and show you one technique that might help you with the discomfort, and also I'll provide you some insights about neck pain and how it can affect your body. First of all, I'm a physiotherapist for 17 years. I work in downtown Vancouver. I run my own practice, and I've been noticing that since the pandemic, the number of people with neck pain has increased a lot. I do think there are factors. So first, definitely stress. Second would be people are working more on the computer, probably also with bad ergonomics. So they're working from home more often, although a lot of them are going back to the office right now. But it's still, I feel the amount of hours people are spending in front of the computer is much higher compared to years ago. And with this, I start noticing different patterns in symptoms when my patient comes, and I want to share with you what they are so you know if you're within this pattern. First one is increased frequency of headaches. So people come with headaches more here on the temple region and also in the back of the head region, very common. Even though they're not having that high level headache, no intensity headache, sometimes they have a low grade headache that kind of lingers throughout the day. And they might take some Advil or Tylenol to help, and that's become like kind of routine, which is not great. Second clear symptom I notice is jaw issues. So tension in the jaw, people clenching without noticing, and it's not during the night only, also during the day. So when they come to the clinic and I feel the masseter, so the muscle here beside on our jaw, they're very tense. And the other factor would be a lot of people having brain fog or difficult concentration associated with other symptoms that I already told you. And that's, I believe, because the neck is so related to our head where our brain sits. And if there is restrictions in the neck, I believe that it can affect the blood flow that goes to the brain. Associated with stress, that also compounds the issue. So people come with multiple issues other than just in the neck. It can be also systemic, especially because when you have the vagus nerve that comes from our brain, goes down to our whole body, it has a huge impact systemically for us. One tip that I can give you is there are a lot of things you can do by yourself. For example, staying active, doing some gentle stretches, or going for doing yourself some massage around your neck. But I believe that really, if you have some professional that has hands-on skills, so that manual therapy skill to help with your upper cervical or even everywhere else, that can be a massage therapist, an osteopath, chiropractor, and a physiotherapist. However, I do believe that the technique needs to be gentle. It cannot be something super aggressive, because I feel this area is so sensitive, and I've seen so many people who had issues after aggressive approach around the neck that nowadays I don't advise major aggressive approach in the neck. The other thing that can help is also dry needling or IMS. So some physiotherapists, they have the skill of using dry needling to release the muscle, gives it a reset. Also is very targeted and very effective. Here in my experience, I see the change when I apply the dry needling for my patients. Of course, there's the right time, so it would depend on the judgment of your therapist to do it. So a lot of things you can do by yourself, but a lot of things I feel if you can have the help of someone specialist to help you is the best. And second thing I want to tell you that is a self-release. The fact that we always think about the muscles in the back of the head, and we do those stretches and we get the massage, maybe you get the massage gun and release the trapezius. Those are all helpful, but what we forget is the front part of the neck. This part, we carry a lot of lymph nodes and also veins and important muscles that relates to the neck and can cause a series of symptoms. So follow this exercise. You're gonna have 3 flat fingers relaxed. You're gonna do 5 circles just below the jaw, 5 circles here in the middle, and then 5 circles more on the bottom here. You can use the other hand, I think it's better. So 5 circles here, very gentle. And I will repeat 3 times on the side, and you're gonna repeat 5 circles on the top here, mid, and then bottom. And repeat 3 times on the side. This way, you can stimulate the lymph nodes around this area and also help relax not just the muscle but also the fascia around this area. I found it's really helpful, and I do teach this to my patients. I just ask you to be gentle because this part is sensitive. Thanks for watching. If you're looking for a physiotherapist, you can look at my schedule. I know my schedule is very busy, but if you leave your name on the wait list, I can always try to find a way to accommodate. You can use the link in my bio. Thank you. Have a good day.